Since the 1920s, Ghana has been working towards making sure everyone has healthcare. The goal is for everyone to have access to doctors and medicine. However, things are not the same for everyone in Ghana when it comes to healthcare. The differences are big, especially for the poorest people. These communities, often in rural areas and far from cities, face many difficulties. They don't have enough hospitals and clinics, there aren't enough doctors and nurses, and it's hard for them to even reach a hospital because of where they live. In 1978, Ghana promised to work towards health for all by signing something called the Alma Ata Declaration. This promise led to the creation of the CHPS program in 1999. CHPS stands for Community-Based Health Planning and Services. The CHPS program was designed to help people in these underserved communities get better access to healthcare. However, even though it had good intentions, the CHPS program has faced many problems. One of the biggest problems is that healthcare costs a lot of money. Many people in Ghana can't afford basic healthcare because it's expensive and they don't have good insurance. This means people often wait too long to see a doctor, which can make their health problems worse. This makes the difference between the rich and poor when it comes to healthcare even bigger. Ghana's culture and traditions can also make it hard for people to access healthcare. Many people don't know much about health issues and rely on traditional medicine. This is especially true in rural areas where traditional beliefs are very strong. This can prevent people from going to hospitals and clinics. The CHPS program is a big part of Ghana's plan to make healthcare fair for everyone. The program has a big goal to bring basic healthcare to every part of the country. The plan was to have small health clinics in communities run by trained community health officers. These officers would live in the communities they served and provide essential services like checkups for mothers and children, vaccinations, disease tracking, and health education. Although the CHPS program had good intentions and saw some early success, it has faced many challenges. One major problem is that there are not enough trained healthcare workers, especially in remote areas. The lack of proper buildings, equipment, and resources also makes it difficult for the program to work effectively. Many CHPS clinics don't have basic things like enough equipment, reliable electricity, or even clean toilets. Another big problem is that there's no system to make sure the clinics always have the medicine and supplies they need. This often leads to situations where clinics run out of essential medicines, making them unable to provide even basic healthcare. The problem is made worse by the lack of reliable transportation for referrals. This means that if a patient in a remote area needs to see a specialist or requires more advanced care, they are often stuck without access to timely and appropriate medical care. The long-term future of the CHPS program is also uncertain. The program relies heavily on money from other countries, which is not always reliable and can change at any time. This dependence on foreign aid makes it hard to ensure that the program can continue to exist and deliver on its promise of healthcare for everyone in the long run. In addition to the physical challenges of not having enough hospitals, equipment, and resources, there are also social and cultural barriers that prevent people in Ghana from getting healthcare. Deeply rooted beliefs and practices often clash with modern medicine. Many communities rely heavily on traditional healers and remedies. This often leads to delays in seeking help from doctors, which can make health outcomes worse. Another challenge is that people, especially those in marginalized communities, don't trust the healthcare system. This distrust often comes from past injustices, cultural misunderstandings, and a lack of awareness about their rights as patients. This lack of trust can prevent individuals from seeking timely care, leading to preventable health complications and continuing the cycle of health disparities. Gender inequality also plays a role. Women, who are often in lower positions in society, face significant barriers in accessing healthcare. They often can't make decisions about their health and need permission and money from men. This lack of power limits their access to essential services, particularly reproductive healthcare. The stigma surrounding certain health conditions such as HIV/AIDS and mental illness adds another layer of complexity. This stigma prevents individuals from seeking help because they are afraid of discrimination and social isolation. This fear not only impacts their health, but also makes it harder to control the spread of infectious diseases and provide appropriate mental health care. As if the existing challenges were not enough, climate change has emerged as a serious threat to Ghana's health system. The country is very vulnerable to the impacts of climate change, with rising temperatures, unpredictable rainfall patterns, and more frequent extreme weather events already having a negative impact. Floods, droughts, and heat waves are becoming more common, impacting food security, water resources, and sanitation, all of which directly affect public health. Climate change worsens existing health risks. The spread of diseases carried by insects, such as malaria and dengue fever, is increasing due to changing climate patterns. These diseases disproportionately affect the poorest and most vulnerable communities, who often lack the resources to protect themselves and access timely medical care. The health system itself is struggling to cope with these climate-related challenges. Many health facilities are not equipped to handle the increasing number of patients with climate-sensitive diseases. The lack of climate-resilient infrastructure makes them vulnerable to damage from extreme weather events, further disrupting healthcare delivery. Ghana's fight for health equity faces many challenges. Addressing these deeply rooted issues requires a multi-sectoral approach, tackling not only the symptoms, but also the root causes. From strengthening the healthcare system to addressing social determinants of health and building climate resilience, a concerted effort is needed to ensure that every Ghanaian has a fair and just opportunity to live a healthy life.